Hello, my name is Laura Donald, and on behalf of Susanna and Rich, I'm here to discuss substance abuse in adolescents ages 12 to 18 in Suffolk County, New York. The main goal of health promotion in adolescence is to improve the healthy development, health, safety, and well-being of adolescents. We believe that reducing substance abuse can help protect the health, safety, and quality of life for all, especially children. Our target population was adolescents aged 12 to 18 in the U.S. Since young adults make up to 21% of the U.S. population, we felt this was very important. We all know what a stressful time adolescence is. Higher stress in early adolescence has been associated with a range of risk-taking behaviors, such as smoking, drinking, drug abuse, and promiscuity. Youth drug use is on the rise, with 1 in 4 suffering from addiction. It is also found that those who use drugs before age 15 are 5 times more likely to become dependent on them later in life. For our assessment survey process, we use the Adolescent Alcohol and Drug Abuse Assessment Risk Screening Tool, which we adapted from the Michigan Alcohol Screening Test and the CRAFT Screening Tool. Participants answered each question honestly since the survey was anonymous, and 1 point was scored for each yes response. If the participants had a total score of 6 or higher, that indicated they had an alcohol or drug dependence and further assistance should have been sought out. Some example questions from our screening tool, which you all should have, would be: at what age did you first use drugs or alcohol? Have you ever been awakened in the morning and found you cannot remember the night before? Does anyone ever complain about your substance abuse? Do you ever feel guilty about your substance abuse? Can you stop drinking without difficulty? Have you ever lost friends because of your drug or alcohol use? Have you ever neglected obligations due to drinking or drug use? Or have you ever been hospitalized due to your substance abuse? The goal of this project is to increase awareness and provide preventative education on the harmful effects of drug and alcohol abuse in adolescent teens. We had 3 main objectives to help us achieve this goal. Our first objective was, by September 2014, 90% of adolescent teens aged 12 to 18 in Suffolk County, New York, will be enrolled in a drug and alcohol prevention and education course in their school. Our second objective was, during the 2013-2014 school year, at least 85% of students ages 12 to 18 will take part in an alcohol and drug screening tool, such as the CRAFT screening tool, to help evaluate underage substance abuse in Suffolk County, New York, and get a feel where the adolescents were. Our third objective for this project was that by June 2014, 100 families in Suffolk County, New York would be enrolled in an educational program where parents would be educated on signs and symptoms of substance abuse, and both parents and teens will learn how to effectively communicate about strategies to help prevent underage substance abuse. For our first objective, we wanted 90% of adolescents to be enrolled in a drug and alcohol prevention and education course in school. We identified 3 interventions that we thought would help us achieve this objective. The first intervention was: high schools in Suffolk County, New York will institute a mandatory drug and alcohol prevention course that will address all forms of drug use, including tobacco, alcohol, marijuana, heroin, prescription medications, and over-the-counter drugs. Students will be actively involved in the program and any assignments initiated. The program would consist of interactive weekly classes that are about 1 hour long, where students will perform different scenarios to build skills necessary for preventing substance abuse and addressing peer pressure. These prevention programs will target improving academic and social-emotional learning to address risk factors for drug abuse, such as early aggression, academic failure, and school dropout. Education will focus on teaching skills such as self-control, emotional awareness, communication, social problem solving, dealing with peer pressure, drug resistance skills, reinforcement of anti-drug attitudes, and academic support. These high school prevention programs will empower teens by incorporating their input into the program and incorporating community service into the program. Teens will be encouraged to participate in community service activities and will also be required to attend Alcoholics Anonymous or Narcotics Anonymous meetings as a part of the program, so that they can see the direct effects that substance abuse can have on individuals and their families. For our second objective, during the 2013-14 school year, at least 85% of the students ages 12 to 18 will have taken part in an alcohol and drug screening tool. For this objective, we identified 3 interventions to help us achieve. Our first intervention was adolescent teens in Suffolk County, New York will take part in a drug and alcohol screening tool during the year. The screening tool is a brief screening that is used to assess the prevalence of problematic substance abuse among teenagers in high school. After evaluating those CRAFT scores, students will be offered referral treatment from school mental health counselors. Results will remain confidential and anonymous to ensure accurate and honest reporting during the screening. The school will set up both group and private sessions where students can feel safe to talk about their experiences with drug and alcohol use. All data from high schools in Suffolk County will be collected and evaluated to determine the statistical data on underage substance abuse in the area, and individual programs will be initiated based on the results of the screenings. This will help us target individual populations at risk for underage substance abuse and help start programs in schools that will help to control underage use of drugs and alcohol in teens. Our third objective was by June 2014 to have at least 100 families in Suffolk County enrolled in a drug and alcohol educational program for students and parents. Family-based prevention programs will help enhance family bonding and increase parenting skills. Parents will learn to develop, discuss, and enforce family policies on substance abuse, and parents will receive information and education about substance abuse and discussing it with their children. Parental supervision is critical for drug abuse prevention, so parents will learn skills such as rule setting, monitoring activities, praise for good behavior, and discipline for breaking the rules. Parents and teens will learn skills to effectively communicate with each other, and teens will be given the opportunity to express concerns to their parents. Classes will consist of acting out scenarios where teens can express themselves and parents can understand the daily pressures that teens deal with every day in school, since school has drastically changed since they were adolescents. Families will learn how to openly and effectively communicate without the fear of repercussions, and this will hopefully help prevent underage substance abuse in Suffolk County. As healthcare professionals, it is vital that we have some knowledge about the different cultural beliefs and traditions of the patients that we are caring for. When we fully understand cultural differences, it allows us to be more effective in our approaches to treatments and the interventions needed to promote health. Culture profoundly influences our thinking and behavior and has an enormous impact on the effectiveness of healthcare. When we use cultural competence in the most effective way, and we can fully understand our patients' cultural differences, it allows us to be more effective in our approaches to treatments and interventions needed to promote health, and also fosters a better relationship with our patients. We must be willing to listen and learn from members of diverse populations, and the provisions of information and services in appropriate languages at appropriate comprehension levels and in the context of the individual's health beliefs and practices. In cultural competent health promotion programs, the beliefs, interpersonal style, attitudes, and behaviors of individuals and families are respected and incorporated into program planning, implementation, and evaluation of activities. Culture can determine how a person reacts to pain, copes with stress, deals with death, responds to healthcare workers, and values their past, present, and future. Health promotion seeks to encourage good health through healthy behaviors and risk reduction, early detection and treatment, and proper care of chronic or acute diseases. In an attempt to make health promotion efforts more cultural competent, cultural-specific attitudes and values have been incorporated into messages and materials. Cultural competency can also increase the value of health promotion activities directed at developmental, racial, and various ethnic groups. It's important when promoting cultural competence that nurses bond with their patients in order to create a sense of comfort and friendship, which is valued in many cultures. Connecting in this manner is a great way to build a trusting relationship and help to ensure patient compliance with healthcare interventions and treatments. When dealing with health promotion in adolescents, it is important to develop a specific approach in order to be effective when working with this population. The nurse must consider language, education level, culture, socioeconomic status, and family dynamic when developing a health promotion plan. In order to develop an effective substance abuse prevention plan for teens in Suffolk County, the nurse must consider all of the above factors and build a positive and trusting relationship in order for the health promotion plan to be effective. The following are some recommendations that may help facilitate a positive experience when working with adolescents. The first recommendation for working with teens aged 12 to 18 in Suffolk County is to develop a trusting and safe relationship. Effective communication between the healthcare provider and the target population begins with establishing a trusting and positive relationship. Establishing a positive rapport and showing respect for the adolescent as an individual is vital to creating an open avenue for communication between the nurse and the teen. The healthcare provider should become familiar with the target population and their everyday lives. Teens should be provided with a safe and comfortable environment where they will feel as though they can speak freely without being judged or punished. Another recommendation is to use facts, not scare tactics, to educate the adolescents. Education is a key component of any plan to change self-destructive behavior, and in order for it to be effective, education must be factual and rational. By focusing educational programs on information which is scientifically accurate, we can achieve our educational goals and become more credible force for our younger generation of patients. Another recommendation is to redirect federal funding for substance abuse prevention programs into more productive and effective programs. Federally funded research conducted found that the DARE program of the 1990s had no effect on adolescent drug abuse, and that DARE students were no less likely to use drugs than students who were not involved in that program. The major reason for the program's failure was the fact that police officers were not effective teachers of health education. Police do not teach children about sex education, hygiene, or dental care, so they were not effective teachers of substance abuse. It was also found that police officers were intimidating to teens, which prevented them from asking vital questions out of fear they would get in trouble. Funding should be focused into more effective substance abuse programs in high schools across the country with the focus on empowering and educating adolescent teens. The goal of drug education should be broadening to include reducing the harms related to alcohol and other drug use, as well as preventing adolescent drug and alcohol use from the outset. Another recommendation is to incorporate family planning into all program objectives. All members of the family should be involved in the substance abuse prevention. Family structure and dynamics is a major factor in determining an effective approach when working with adolescents. Depending on the family dynamic at home, the healthcare provider may need to approach each individual teen in a different way. Family interactions may have a significant effect on how a teenager learns about and handles substance abuse and other healthcare issues. In order to be effective, the healthcare provider should first assess the family structure and family interactions in order to appropriately determine the most effective plan of care for that individual teen. The nurse must respect the adolescent's autonomy and independence at all times because this will encourage open communication between all family members and the healthcare provider. It will also allow for some private discussion alone with the teen so they may express individual questions or concerns without feeling uncomfortable in front of their family. This allows the parents to be actively involved in the health teaching of their children, and it also gives adolescents a sense of independence. Evaluation is the process of collecting and analyzing information and its undertaking to learn the value of a health promotion program or intervention. Evaluations help assess if program objectives were achieved, to improve program implementation, to contribute to the scientific knowledge of health promotion, to provide accountability to funding agencies, and to inform policymakers. Evaluations also provide information to enable healthcare providers to make decisions about resource allocation, as ineffective programs can be eliminated and new ones can be implemented to promote change. Some questions that may be answered by a comprehensive evaluation include: is the health promotion intervention effective in an ideal situation? Is the health promotion intervention effective in clinical practice? How does the health promotion intervention work? What are the intended and unintended outcomes of the health promotion? What resources are needed to implement the intervention or program? Is it cost effective? Are clients satisfied? Who will benefit from the intervention? How can the program or intervention be improved? Our teaching plan objectives were based on the ability to involve adolescents aged 12 to 18 in Suffolk County, New York, to participate in a substance abuse prevention program. The following are some proposed evaluations of our 3 program objectives. Our first objective was that by 2014, 90% of adolescent teens would be enrolled in a drug and alcohol prevention and education course in school. To evaluate this objective, schools in Suffolk County would be required to institute their substance abuse prevention program and record attendance of each student. By 2014, each school should have a 90% compliance rate with all high school age teens enrolled in a program and actively involved in the program. As part of the program, students and healthcare providers should provide input on the effectiveness of the program and both the positive and negative aspects of what improvements could be instituted. For the following school year, the 90% compliance rate should be maintained to continue to monitor the program effectiveness. End-of-course surveys would be a great option for this evaluation. Our second objective was that during the 2013-14 school year, at least 85% of students would have taken part in an alcohol and drug screening assessment tool, such as the CRAFT tool, to evaluate underage substance abuse in Suffolk County. At the end of the academic school year, the school will provide documentation and screening results showing that at least 85% of the students in the target population participated in an anonymous screening tool to help healthcare providers better understand the risks and actual statistics involved. In the following school year, schools should aim to increase screening school participation to a higher rate than the initial 85% compliance rate. The third objective was to have 100 families in Suffolk County enrolled in an educational program by June 2014. At the end of the academic school year, records would show that at least 100 families in the target population were involved in the educational program, and feedback will be provided from parents, teens, both on positive and negative aspects of the program in order to make positive changes in the program for the future. For the following school year, the program should be expanded to include at least 200 families across Suffolk County to help increase subject data and increase program effectiveness. There is good reason to be concerned about underage substance abuse because research has shown that the earlier age of onset of abuse, the greater the likelihood of addiction and dependence. There is also a host of other problems directly associated with illicit drug use by adolescents, including injury, neurocognitive damage, developmental delays, and other physical illness. It has been shown that providing education and support to adolescents can have significant impact on the rate of substance abuse, and those who are aware of the risks and consequences of using drugs or alcohol are less likely to become addicted. We hope our teaching plan helps educate the adolescent teens of Suffolk County about the physical, emotional, and psychological risks that are involved with illegal drug use and alcohol abuse.